Have you ever wondered if testosterone replacement therapy TRT is the right choice for you? Are you curious about its benefits and concerned about its potential risks? Welcome to a journey of understanding and discovery as we dive deep into the world of TRT. In today's comprehensive guide, we'll explore the myths and facts surrounding testosterone replacement therapy. From addressing common misconceptions to discussing the critical aspects you need to know before considering TRT, this video is your go-to resource. We'll tackle the important questions. What are the real benefits of TRT? How does it impact your health in the long term? And most importantly, is it the right solution for your specific health concerns? Join us as we unravel the complexities of TRT, providing you with the knowledge and insights you need to make an informed decision. Whether you're someone diagnosed with low testosterone levels or just curious about the therapy, this video is designed to cater to all your queries. So let's get started on this informative journey. And if you find our content helpful, don't forget to hit the like button, share with those who might benefit, and subscribe to our channel for more health insights and updates. Your engagement helps us create content that matters to you. Let's begin. Benefits and risks of testosterone replacement therapy. Let's start with the heart of the matter, the benefits and risks associated with testosterone replacement therapy. Understanding these is crucial for anyone considering TRT as a treatment option. 1. Benefits of TRT. If you've been diagnosed with abnormally low testosterone levels, known as low T, TRT can offer significant benefits. Testosterone is a key hormone in the male body, influencing everything from bone density and muscle mass to sex drive and sperm production. As we age, testosterone levels naturally decline, and this is where TRT steps in. By supplementing your body's natural testosterone, TRT can help. Restore healthy erections. If low testosterone is at the root of your erectile dysfunction, TRT may help in regaining healthy erectile function. Boost sex drive. Many men report a noticeable increase in their sex drive after starting TRT. Improve energy levels. A common benefit of TRT is an overall improvement in energy and vitality. Reduce body fat and increase muscle mass. TRT can contribute to a more favorable body composition with reduced fat and increased muscle strength. 2. Risks and side effects of TRT. However, it's not all positive. TRT comes with its share of risks and potential side effects, which must be carefully weighed against the benefits. These may include acne and oily skin, a common side effect, particularly at the start of therapy. Lower sperm count. This can lead to infertility issues, a significant concern for men looking to start or expand their family. Increased risk of blood clots. TRT can contribute to a higher likelihood of developing blood clots, which can be life-threatening. Shrinkage of the testicles. This is a physical change that some men may experience while on TRT. Enlargement of breasts. Some men may notice an increase in breast size due to hormonal changes. Heightened risk of heart attack and stroke. This is a serious concern, particularly for those with a history of heart disease. It's essential to approach TRT with a clear understanding of these potential risks. While TRT can be life-changing for some, it's not a decision to be made lightly. Each individual's medical history, current health status, and long-term health goals must be taken into account. Conditions where TRT should be avoided or approached with caution. In this segment, we'll navigate through some crucial considerations regarding testosterone replacement therapy. It's not just about knowing the benefits and risks. It's equally important to understand when TRT may not be the best option. Conditions advising caution or avoidance of TRT. 1. Prostate and breast cancer. The Endocrine Society's guidelines are clear. If you have prostate or breast cancer, TRT should typically be avoided. Testosterone can fuel the growth of these cancers, making TRT a risky proposition in these cases. However, there's an evolving perspective for certain cases, particularly in prostate cancer. Some studies suggest that men who have been successfully treated for prostate cancer might be candidates for TRT, under strict medical supervision and regular screening for signs of cancer recurrence. 2. Obstructive sleep apnea. For those suffering from severe obstructive sleep apnea, TRT could exacerbate the condition. It's essential to treat the sleep apnea effectively before considering TRT. 3. Severe lower urinary tract symptoms. If you're experiencing severe symptoms related to an enlarged prostate, such as frequent and urgent urination, TRT could worsen these symptoms. 4. Severe congestive heart failure. Patients with advanced heart failure need to be cautious. TRT can exacerbate the condition, leading to more complications. 5. Above normal red blood cell counts. High red blood cell counts can increase the risk of blood clots, and TRT can raise these levels even further. This risk needs careful management and monitoring. Other considerations. Your doctor should assess your risk for prostate cancer before starting TRT. This typically involves a prostate-specific antigen PSA test and possibly a digital rectal exam. Bone density measurements might be necessary if you had osteoporosis when treatment began. Individualized assessment is key. It's vital to remember that each case is unique. What might be a green light for one person could be a red flag for another. Your healthcare provider should conduct a thorough assessment, considering your medical history, current health status, and specific risk factors. Testosterone Replacement Therapy and Erectile Dysfunction Ed. Moving forward in our discussion about testosterone replacement therapy, an important aspect to consider is its impact on erectile dysfunction ed. This is a topic of significant interest for many considering TRT as a treatment option. Understanding the link between TRT and ed. Role of testosterone in sexual function. Testosterone plays a crucial role in a man's sexual drive and performance. It's a key factor in maintaining the ability to have healthy erections and a robust sex drive. TRT is a treatment for ed. If your ed is primarily due to low testosterone levels, TRT might help in restoring your ability to achieve and maintain erections. It's not just about improving sexual performance. It's also about enhancing overall sexual satisfaction and drive. However, it's important to note that ed can have multiple other causes. These include vascular disease, nerve damage, psychological factors, and more. Therefore, while TRT may be part of the solution, it might not be the complete answer in every case of ed. Comprehensive assessment is crucial. Before jumping to TRT as a solution, it's critical to have a comprehensive evaluation. This means talking to your doctor to determine the root cause of your erection problems. Only after identifying that low testosterone is a key factor in your ed should TRT be considered as a treatment option. Other treatments for ed. In cases where ed is not predominantly due to low testosterone, other treatments such as phosphodiesterase type 5 inhibitors, lifestyle changes, or psychological counseling might be more appropriate. Monitoring and adjustment. If you start TRT, it's important to monitor its effects on your ed symptoms. Based on your response, adjustments to the therapy might be needed to optimize results and minimize side effects. As we can see, while TRT can be a valuable treatment in specific instances of ed related to low testosterone, it is not a universal solution for all types of ed. A careful evaluation and a tailored treatment plan are essential for effective management. Forms of testosterone replacement therapy. As we progress in our exploration of testosterone replacement therapy, it's essential to understand the different forms in which TRT can be administered. Each method has its advantages and disadvantages, and the choice largely depends on personal preference, lifestyle, and medical considerations. Diving into the different forms of TRT. 1. Patches. Patches are a convenient form of TRT. They are easy to apply and offer a steady release of testosterone. However, they can cause skin rashes and may need to be applied more than once a day. 2. Gels. Gels are another popular option. Applied daily, they are easy to use and absorb directly through the skin. However, you must be cautious to prevent skin-to-skin contact with others for several hours after application to avoid transferring testosterone. 3. Nasal gel. A relatively newer option, the nasal gel, reduces the risk of testosterone transfer to others. It's applied inside the nose and is convenient for those who prefer not to use skin applications. 4. Buccal patch. This is a patch applied to the upper gum twice a day. While convenient, it can sometimes cause gum irritation or discomfort. 5. Injections. Testosterone injections are given every 2 to 10 weeks. They are generally less expensive, but can lead to fluctuations in testosterone levels, potentially affecting mood and energy levels. 6. Subcutaneous pellets. These pellets are inserted under the skin every 3 to 6 months. They provide a steady hormone level and are convenient once in place, but require minor surgery for implantation. Choosing the right form for you. The choice of TRT form is highly individual. Factors such as lifestyle, convenience, cost, and personal medical history play a significant role in this decision. It's also important to consider the potential side effects of each form and discuss these with your healthcare provider. Regular monitoring and follow-up are essential regardless of the form chosen to ensure the therapy is working effectively and to adjust the treatment as needed. Monitoring and management while on testosterone replacement therapy. In this segment, we'll focus on a crucial aspect of testosterone replacement therapy, the monitoring and management process. Ensuring the effectiveness and safety of TRT requires regular medical supervision and checkups. Key aspects of monitoring and management in TRT. Regular testosterone level checks. Once you start TRT, it's vital to regularly monitor your testosterone levels. This usually occurs at the 3 and 6 month marks after the initiation of treatment and then annually. These checks help in determining whether the TRT is effectively maintaining testosterone levels within the desired range. Adjusting dosage. Depending on your testosterone levels and your response to the therapy, your doctor may adjust your TRT dosage. The goal is to find the right balance that alleviates symptoms while minimizing side effects. Monitoring red blood cell levels. Alongside testosterone levels, your doctor will also monitor your red blood cell count. An increase in red blood cells can be a side effect of TRT, potentially leading to complications like blood clots. Evaluating bone density. If you had osteoporosis at the start of treatment, your doctor would measure your bone density within 1 to 2 years of starting TRT. This helps in assessing the effectiveness of the therapy in improving bone health. Prostate health surveillance. Prior to starting TRT and regularly thereafter, your doctor will evaluate your prostate cancer risk. This might include PSA tests and physical exams, especially important for those with a family history or other risk factors for prostate cancer. Recognizing side effects. Patients on TRT should be aware of potential side effects, such as chest pain, difficulty breathing, or signs of a stroke like weakness or slurred speech. Immediate medical attention is crucial in these cases. Lifestyle considerations and support. It's important to maintain a healthy lifestyle while on TRT, including a balanced diet and regular exercise. Additionally, mental health support and counseling may be beneficial, especially if mood swings or emotional changes are noticed. Conclusion of monitoring segment. Regular and thorough monitoring is the backbone of successful TRT. It ensures not only the effectiveness of the therapy, but also safeguards against potential risks and complications. In our next section, we'll discuss the expected duration of TRT and its long-term implications. Duration and long-term implications of testosterone replacement therapy. As we continue our comprehensive exploration of testosterone replacement therapy, it's important to address a common and significant question. How long do I need to be on TRT, and what are the long-term implications? Understanding the duration and longevity of TRT. Indefinite duration of therapy. TRT is not a cure for low testosterone. Rather, it's a treatment that manages the symptoms associated with low T levels. This means that TRT is generally a long-term commitment. If you stop the therapy, your symptoms may return as testosterone levels drop back to their original low levels. Long-term commitment. The decision to start TRT should be made with the understanding that it may be a lifelong therapy. Regular monitoring and consultations with your healthcare provider are crucial to manage the therapy effectively over the long term. Potential long-term benefits. With sustained TRT, many men report improved energy levels, better mood, increased muscle mass, and a more robust sex drive. These benefits can significantly enhance the quality of life. Managing expectations. It's essential to have realistic expectations. While many experience positive changes, the degree of improvement can vary. The therapy may require adjustments and patience to achieve the desired results. Long-term risks and considerations. Like any long-term medical treatment, TRT has potential risks and side effects that may emerge over time. These include cardiovascular risks, effects on prostate health, and the potential impact on fertility. Regular health checkups, lifestyle adjustments, and staying informed about the latest research and guidelines in TRT are key to managing these risks. Conclusion of duration segment. Embracing TRT as a long-term solution requires a comprehensive understanding of both its benefits and potential risks. It's a journey that involves ongoing collaboration with your healthcare provider to ensure that the therapy continues to align with your health goals and needs. Summarizing testosterone replacement therapy. As we come to the end of our detailed exploration of testosterone replacement therapy, let's recap the key points and consider the next steps for anyone thinking about TRT or already on this treatment path. Key takeaways. Benefits and risks. TRT can significantly improve symptoms of low testosterone, including sexual dysfunction, low energy, and decreased muscle mass. However, it's vital to weigh these benefits against potential risks like cardiovascular issues, hormonal side effects, and the implications on prostate health. Suitability and caution. Not everyone is a suitable candidate for TRT. Conditions like prostate and breast cancer, severe obstructive sleep apnea, and certain heart conditions warrant caution or outright avoidance of TRT. Different forms of administration. TRT comes in various forms, including patches, gels, injections, and pellets. Each has its pros and cons, and the choice depends on individual preferences, lifestyle, and medical advice. Importance of monitoring. Regular monitoring is crucial to manage the effectiveness of TRT and to mitigate any potential risks. This involves regular blood tests, prostate health checks, and monitoring for any side effects. Long-term commitment. TRT is usually a long-term treatment, often lifelong. Stopping the therapy can result in the return of low testosterone symptoms. Next steps and guidance. Consult with a healthcare professional. If you're considering TRT, the first step is to consult with your healthcare provider. An accurate diagnosis and a thorough understanding of your health condition are essential. Informed decision-making. Make sure you are fully informed about the benefits, risks, and commitments associated with TRT. It's a decision that should be made with a clear understanding of the long-term implications. Lifestyle considerations. Alongside TRT, maintaining a healthy lifestyle including diet, exercise, and mental health is crucial for overall well-being. Stay informed. Medical guidelines and recommendations can evolve. Staying informed about the latest research and discussions in the field of TRT will help you make the best decisions for your health. Wrapping up. Testosterone replacement therapy is a powerful tool in managing the symptoms of low testosterone, but it's not a decision to be taken lightly. It requires careful consideration, regular medical supervision, and a commitment to ongoing health management.
Thank you for joining us on this comprehensive guide to testosterone replacement therapy. If you found this video helpful, please like, share, and subscribe for more informative content. Should you have any questions or wish to share your experiences with TRT, feel free to leave a comment below.